You know, the last time you and I talked, it was kind of in the hub of a lot of staffing transition, and I just would love to hear how you guys have managed with all of the staffing changes, and how's your staff doing with all of this?
You know, I think everybody, like for me, I really like her. I mean, I would love for her to stay. She's a perfect fit for our facility. But I think everybody's a lot on edge, because that when she's gone, everything's changing again.
Yeah.
That's probably where the majority of us are, especially ones who went through multiple CEOs. So that's my challenge, but hell, I've done it for so many years that I guess I'm ready to do it again. It's just, it's just the hard thing is she's so easy. I mean, she was like an easy transition to go from no CEO and what we had to hers interim has been awesome. I mean, it's just great.
Isn't it?
But I know the honeymoon's coming to an end.
Yeah. Isn't it amazing though, the difference that one person can make?
Yes, absolutely. Yep.
And you wouldn't think that to be the case, but it truly does show that leadership is super important.
Yep.
However you end up getting it. How's your census at your facility doing?
Oh, it's kind of all over the place. I can't say we really recovered from when COVID hit, but like our ER, maybe our ER goes and goes and goes and we're busy there and we don't have any patients. Or we have a few patients on the floor. It's just so variable. It's all over. It's not like anything consistent and steady with like floor nor ER.
And you guys have had a pretty consistent census for the last years,
yeah.
Right?
Mm-hmm.
So, what about staff turnover? How are you guys?
It's really not too bad on staff turnover. We had some big physician changes. We had our third employed physician that was here. She left in July, I think. And then our other physician that's still done a lot of admitting, covered the ER, passed away.
I heard that, and that was unexpected.
Yes. It was like one day he got up and he had diagnosed with the condition and in about, then put into a nursing facility or care facility, and then boom, he's dead.
Wow.
So we're down 2 physicians. So we got locums, but one of our locums happens to be one of our docs that was here before. So that's awesome that she's back, taking call. And then we got a locum in to cover Dr. Gittitu. And that locum is, everybody loves her. Community loves her. We'd like to see her stay, but she's young and she's got, she wants to do fellowships and do all that fun stuff. So you can't hold her back there,
Mm-hmm. Talk to me a little bit. Last time we were chatting, you probably had 10 different hats that you were wearing just to keep the wheels on your bus. Has your role changed now?
Yes. So now she put me in as corporate compliance, and then I still kind of oversee the credentialing and all that, but that way I can, try to help her with, getting signed up, what's due, when do we have to have this done, when do we need to have that done. So it works out really well. I mean, I've got the stressors of managing staff gone, and I like that because I'm too damn old, Monica. I cannot do this millennial bullshit.
Yeah. Let's talk about that. That's an interesting, really though. Are you seeing different coping mechanisms from more seasoned staff versus people who haven't been there? Are you seeing anything you can quantify based on the generations?
Yes. I mean, you see it. You know, like as far as like, if I tell you I'm going to have you that paper to you tonight by 5 o'clock, well, tonight maybe tomorrow night, the next night, the next, they have no concept with deadlines, could care less, and it don't bother them. It just don't bother them. I mean, I wish I had that nonchalant attitude kind of, but it's really hard. And a lot of us talk about it, the ones of us that are closer to my age talk about, how do you deal with them and how do you get by with them? And, and the great thing for me, I can say is Kendra, Kendra finds good in everybody. God save her soul. But, I'd like to say I believe that way, but I don't. I mean, it's just hard. It's really hard to have the philosophy she has, but she helps me through a lot. I mean, the neat thing with me is I can utilize Kendra to be a sounding board that really in my position, I can't go talk to other people. You know what I mean? Mm-hmm. So my role's changed a lot. My interactions with staff has changed. Some I can laugh, joke, have a grand old time. It's no big deal. But for the most part, it's strictly pretty much business. It's not no fun, I mean, good morning, how are you? How's things going? But I don't have those visits. So Kendra's probably my big, and even Darcy, I mean, oh my God, she's awesome. I can't say enough good about her.
How's your board? Are they kind of moving forward with some of this, or?
Yes, we've got a total new board, and they are 180 from what we had before, so it's really great. Our board before was very into day-to-day operations, where this board is more learning about what's right, what do they got to do, how do they stay in compliance. I mean, they're just really all about learning the rules, knowing the rules. I feel like they're very facility focused. It's not just they're on the board because they want to be on the board. They're on the board because they want to make a difference. You know what I mean? They want to help. They want to see us grow.
How do you think the future of your facility is going to be different now because of that different board leadership?
Oh, I think we'll see some things that maybe, without saying a lot, all I can say is, it's kind of like, say K-Hack owns a company car. The company car's broke. You just need to get rid of the company car and move on, but nobody will let you get rid of the company car because it belonged to Susie, who's part of the community. But you get this whole new board in and they're like, get rid of the car. You know what I mean? They support those new decisions because they don't have that investment in the past. You know what I mean? They aren't taking that past things. They're taking it for what that CEO is telling them now and moving forward. So that, to me, in my eyes, is going to be great. I think we can move. I mean, I have big plans. I think we can move ahead a lot. The downside to that is, what are we going to get as a CEO? If we had Darcy, hands down, we're gonna rock on. But I don't know what that new CEO. And probably, if you want to know the truth, if anybody's probably more worried about what we're going to get as a CEO than anybody else is me. I'm very concerned. Because, I've seen those that are all in about it. They build their resume. I've seen those ones that are just in it to get something in so they can say, Johnny Joe got this in. If they have the heart in the place the way Darcy does, we can move. We can rock and roll. But I don't know what we're going to get in.
So how many years have you done this?
29.
Has this been one of the most challenging years you've ever been in?
Yeah, I'm going to say close to it. Most challenging time. It probably has. It's been pretty close. 2015 was pretty rocky road. It was pretty rocky here until we got the interim. And then I'm going to say, and it took a little bit. But it's been tough. And in COVID and the rules and, young people have different styles of leadership, and it's hard for me to adapt. And I think it's hard for a lot of us older managers to adapt to, you know what I mean? I'd say that's probably the biggest thing. I think we've adapted well with all the COVID changes. I mean, it just seems like, a new rate comes out, we tell everybody we got to change again, they do it. That really hasn't been the big challenge, but it's just, I think more so than anything. I mean, like a big thing right now among all of our employees is the stamps, the security thing, to where they're, not going to withhold Social Security, and then they're going to double take it out, and it'll be due in April. And everybody, you got those people saying, oh, I think they'll forgive it. Well, somebody like me is very concerned because, we have a lot of employees that don't make a huge amount of money.
Right.
You take $11, $12, $13 an hour person, those months, January, February, March, those are tough months. And then they're basically doubling, taking out money. That's tough.
Well,
I'm really concerned about that.
And has that passed? I mean, there's been so many changes. Who do you rely on for good information? Right. And let's talk about that, because I didn't know that was actually going into fruition.
Yeah, because we were supposed to start September 1st.
Where have you gotten the best reliable information?
I don't really know where everybody else gets theirs. I mean, I belong to a lot of health lawyers, JD Law, things like that I probably spend 2-3 hours a morning just trying to go through them to find new and updated information. Two, we get a lot through our Colorado Rural Health. Special District Association, they keep us abreast of
different changes. Yeah. What, we've talked about this a little bit. So how is all of this uncertainty and constant change, how has that really affected your future outlook on healthcare? Well, your future outlook?
It don't give me a very bright one. I really don't. The big thing, I don't know. I just feel really concerned for a lot of the healthcare industry as a whole. And, to me, I feel like they've dropped a few standards, and I think other facilities have dropped a few standards. Are they going to pick that back up and maintain it? Or are we just going to stay in this mode of, well, whatever? And now healthcare's coming to telemedicine. My problem with telemedicine is if you can't touch, see, I mean, you can see your patient, but you're seeing them in a different light. I can see you. Yeah, you look great. You're healthy. How do I know you're healthy if I'm not touching you, listening to your heart? You know what I mean?
Good, right? Yeah.
You can bullshit anybody. You know what I mean? You can sit and look great and grand, and I don't know. I'm just not sure. I feel like healthcare is going to take a different direction. Maybe, maybe not. I don't know. Funding, I don't know how we can keep up the funding. They talk about all these millions of dollars that went all over. how do we support that, and how are you going to continue to support that, especially with the ongoing COVID? I mean, like right now we're in a rise again,
Right.
and how long is it going to go on, and how long can we support this?
Well, and how do you identify burnout and fatigue in yourself and in others that you work with?
Right. Yeah, I get concerned about nurses on the floor. I mean, it's like they're working a lot of hours. Well, not only that, but we have a lot of pregnant ones. So when you take 5 pregnant RNs that are going to be out, where are you going to get them? And then they come out here and you pay, your pool staffing $65 an hour to have that nurse. I just don't know how it's all going to go. I don't. Same with COVID testing. How long is that going to last? What are you going to do?
Do you know of anybody who has been sick with COVID personally?
Yes. Yeah, we've had, I think our county alone, I think they said the other day we're up to 97.
Well, in the whole scheme of the world, 97 is not really big unless you know that your county has, 2,400 people, maybe?
Yeah, we're like 48. I don't know, but in the county's bigger, but 90% of those people,
Mm-hmm.
I mean, year round, we kind of went through, some internal things that we had. And so, yeah, it was scary there for a while.
Do you think the community's taking it seriously?
No. You go like, I'm very anal about wearing my mask outside. So like last night in the grocery store, there may have been me, the checkers, maybe 2 other people in the whole grocery store. Hardly anybody wears masks out here.
I went to a funeral a couple weeks ago in Akron, and there was probably 150 people at that funeral, and I saw 3 masks.
Mm-hmm. Yep. We went to my husband's sister's funeral down in Hugo, and that's the way it was there. There was him and I had masks on. I think there's 2 or 3 other people, and that was it. And there was probably, I don't know, 80, 90 people there. So, I don't know.
How has this influenced your family? You're still married, right? I'm still married.
Yeah, I'm still married. I'm still married.
I'm still married.
Yeah, matter of fact, we're celebrating our 40th wedding anniversary on November 2nd.
Okay.
So we are going to venture out into COVID. My husband's like really freaked out. COVID, it freaks him out. It does me too, to a point, but wash your hands, wear your mask, do your things, you're okay.
Yeah.
And I get it. He's 75, he'll be 76, and he's got a lot of comorbidities, so he gets really freaked out. So I'm not really sure. We're going somewhere, but whether we're going to have to sleep in our car or in a tent.
Well, Ted and I had our 30th wedding anniversary. We were supposed to be in Jerusalem, and instead we went to Wyoming. And actually, you know what? It was okay. I mean, it wasn't the dream, but
right.
But people were kind. There were very few people there. I would recommend Wyoming as a place to go in the middle of a pandemic. Right. Wyoming's a great place.
Yeah, I wouldn't mind. I want to go to Wind River and go snowmobiling.
Yeah, exactly.
Yeah.
How is your family doing?
They're doing good. Everybody's on their mission. Everybody's getting older, so the older you get, the more problems you have.
Mm-hmm.
But anyway, everybody's doing really good. I mean, my husband's doing great. No issues, and
that's a gift.
with you guys, your family.
Well, my dad had a health crisis a couple months ago, and now he's living with me because,
Oh,
because I just couldn't be that person that would put her father in a nursing home in the
right,
middle of a pandemic.
right.
And
Yep.
so I we've been working with home health, and they've been amazing. And it's been awkward at times because they're all messed up and you can't understand them. And
Yep.
but you know what? There's been a huge blessing. Um, I've learned a lot about myself. Maybe some things that aren't as attractive as others, but by God, I'm going to own them. I think that COVID has helped our family kind of come together a little bit. Just kind of as an aside, my 3 weeks before my dad had his emergency, my sister decided that he should write a new will, and so figured out how to get internet to his house. And one of the things that the governor passed was that with COVID, you suspended the rules for creation of wills and other legal documents. So just like you were saying about telemedicine, the concern is you don't get to see these people. Well, I'm in
Right.
a family where my father entered into a will, a trust, and gave his power of attorney away to, um, yeah, to a family member, and that family member may or may not have been present at the time, but he's computer illiterate.
Oh
And
my.
so I think it's just, for me, it's a really, the drama side and all that, it's a sad statement that
Mhm.
in this time of crisis, in our efforts to try to communicate and make sure that it was business as usual, he's an 80-year-old man who now has a trust, and he doesn't understand. He has to undo it now because he's better, but he didn't
Right.
understand that the scribble pad was a signature pad.
Oh my
And
God.
so I'm just, we're going to learn all kinds of these stories of
Yep, we
youth,
are.
and I think in the rural community, it's even going to be more telling because
Mhm.
we I keep reaching I keep reaching over to pat your head. I mean, to touch and to do that, and I hope that we figure out a way so that if we are going to become this great computer oriented world, that we have steps and checks and balances so that
Right.
people aren't going to be abused. But yeah, it's been a really sad thing to watch, as somebody who believes in technology and believes that it could potentially be the solutions to many of our problems, has been firsthand up to my elbows in what could go wrong with
Right.
technology and people not understanding it.
I agree.
So,
It's
but I'm doing fine. I think I'm becoming a better person. I'm learning stuff. Um, but you know, there's such good things that have happened, and people have been kind, and I think there's more understanding in the world,
Mhm.
and I think that'll go a long ways. How we transition back to what the normal is, I don't know, Shauna. I
I
don't know
know.
how we do that when people are are weary. Do you find, I mean, I myself am weary. Do you find you're weary and you maybe are addressing things differently than you would have 9 months ago?
Yeah, I do. Um, I don't know. I don't even know how to say it. It's just I feel like my life is on a fast track right now. I can't keep up with everything. You know, it's go, 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 do, do, do. Hurry up, hurry up. You're always behind. I mean, If I was to die right now, I mean, I'm sure they'd either lose my casket or lose my urn or some goddamn thing along the way because something. That is just how my life is like. I feel like it is. It's just spinning out of control. It's just weeks are just clicking off, and I don't know why.
But do you think that's because you're connected? So you're connected? I mean, we had phones. We talked before. What is the connection now that we didn't have 9 months ago? And why is that so ever present in our lives?
I don't know. I don't know. I really don't. I track mine up to getting older every day, and I'm slowing down, and I just can't keep up with a fast-paced world. Maybe that's an excuse. I don't know.
You're a go-getter. We had house guests, and I really wanted the house to look nice, and with all the aides and all these other people, it's just been kind of constant. And so anyway, I knew it wasn't going to be to my normal standard when we had these guests, but I didn't want to tell them that my dad was there because they were Ted's cousins, and I really wanted them to come. So I did my best, and everything was off a little bit, and then I go into this guest bathroom, and I turn around, and I look at my towels. Oh, I bought new towels, and I hung up new towels. But I kept the price tags and the stickers of the new towels. And I was so proud of these towels that I was trying to be thoughtful. I wanted everything to be nice, and I thought to myself, well, that was about a 90% effort, and in the whole scheme of things, it didn't matter that I kept the price tags on them, but that's not something I would have ever done. Just that little tiny thing.
I know.
It's just like, why did I do that? That I didn't have time to take the price tags off, and it's so for me, I'm thinking humility. Maybe we type A women. This is our chance of saying, it's okay if it's 90. It's okay if it's 90%. I don't know, but I was like, I would have been mortified in my prior life, and they were like, Ross, like buy for less or whatever. So I thought you would enjoy that.
Oh, absolutely. I get it. I get it 180%. I mean, my thing is, that's with me. It was just like, I'm going to tell you, since you shared a story with me, I'm going to share with you. Like, I am anal. I walk in, there's stuff on the floor, the vacuum gets out. Don't care what TV program you're watching, what you're doing, the vacuum is going to go because there's stuff on the floor. So the night before, we'd sit there and we'd watch the movie and we ate popcorn. Well, you know what that's like. You got popcorn all over the floor. So anyway, I walk in the next night from work and I'm like, popcorn. Nope. I left it. I didn't even get the vacuum. My husband's like, you gonna get the vacuum? I'm like, shit, no. If it bothers you, you can do it. He's like, oh no, I'm not. I'm just saying.
And that's just such a great story, though. I mean, it's just like my child's like, yeah, it's really not. I'm either too tired or maybe it's just not important. And I was like, oh my gosh, I just learned that. Just a couple final questions because I want to be mindful of your time. Are you guys doing okay on your PPE?
Yeah, we really are. I mean, the neat thing that we had going for us is we had a stock. It went quickly. We were able to have enough of a slowdown to restock, and then we got a new purchasing manager who made a awesome difference. And she had worked here before, just not in the leadership role. And she really took over, and I mean, she was on the hunt for anything she could get. And we are like A-okay. We're ready for our flu bout.
Good.
Yeah, so it's been really good. We had kind of a hard struggle there for a while and it was just a manager. I mean, managers today have an issue where I feel they they're put in those positions without training or going through leadership courses. So to me, it's very hard for them. They don't understand the management end of it, the importance of it. Because 90% of them are millennials who don't give a shit if you got toilet paper or if you don't. You know, because they'll figure out something else. So that part's been hard. That's been hard. And that's probably one thing now that is a challenge, because we have a lot of new managers that, you know, back in the old days, we used to have at least a minimum of leadership training course to go through before we were ever a manager. Well, you know, this day and age, you can't wait. You know, you get somebody that's qualified to do the job, they may just not have the training. You got to put them in and fill that position, hoping that you can grow and mentor them, but it's tough. So we've had a big role with that. I mean, that's probably been our biggest thing. But once we got that under control and this girl got in, I mean, she did take over and do a great job. But it's an issue. We got a lot of new managers.
And that makes it. What kind of support can KHAC give you guys?
Well, you know, I don't know. You know, I know you do a lot as far as training and leadership, and we need that out here. They need to go through some courses, classes to learn. And probably us older people need to go through classes to learn how to deal with them while they're growing. You know what I mean?
Well, I think that's fair because, I mean, we're set in our ways.
Yeah.
And we think it's a certain way, and it is different. I mean, this is the first time in history that we've had so many different age cohorts in the environment at the same time with very different skills.
Uh-huh.
And we approach things really differently. And it's just such common sense things that you wouldn't think about. Samantha, who's our new admin, really bright young lady, she'll be listening to this video. And today I have a story. Today she's helping me with getting invoices for the audit. So she comes in the office and she's found almost all of them, which was amazing. She has these little notes on a piece of paper, little pad. And I looked at her and I said, well, why didn't she just copy the email? Just, you know, because it's all like hand scribbled on and all this stuff. And I wouldn't even have started that without first copying the piece of paper. And she looks at me and says, oh well, I didn't even think about it because, you know, I didn't know if I should print a piece of paper. Whenever you're using a pad of paper on both sides and I can't read it. Yeah, but it was just, that I think is just a really good example of
yes.
I wouldn't have approached it without doing that. I mean, that's a tool there. But in her mind, it was just not necessary because she had a different piece of paper she could write it on.
I know it.
I'm like, well, why didn't you write it on? And so then I went to go show her that I knew what I was doing. And I printed a first piece and it only printed half the page. I'm like, okay, wait a second. Okay. So I tried to be all like, yeah. But it is just truly a different environment. And I think we're all under stress and we're all coming together at the same time. So it's, I don't know, kind of makes me crack up a little bit and think, I birthed some of these millenniums and we've given them different tools and different expectations. And now we're surprised that they have different solutions to our age-old problems. And
oh yeah.
You know, just, I think that's awesome to see that. And you really can learn from each other, but it is that mindset. I did talk to Darcy and Kendra and said that I would be happy to do some of our training, our board trainings. Kind of waiting to hear back from Kendra and get some dates and some contact information. But we have a lot of really cool programs that we could talk about the strategic thinking versus strategic planning. That's kind of an interesting course for managers to think about. It's not so much to think about what the solution is, it's you have to do it.
Right.
The doing it that is the different age cohorts do it differently. And the other one is that really fun program with the true colors,
Hmm.
because that's fun and you can kind of make fun of yourself
Right.
a little bit and you can see differences in each other. And so I'm kind of waiting to hear back. So hopefully I will see you in person.
Oh, well, good. Super.
And to come down and do that. And then we have a KHAG board meeting coming up in a couple weeks with a new chair. And so that's going to be really different too, because he has some ideas of doing things. Some of the ideas are that health education, workforce development, there's some really strong topics. Why don't we divide this up amongst the board and say, Shauna, you're interested in workforce development. How do we focus on that and really start opening those avenues up to I'm giving you more resources, because we have some that I just haven't been giving. So shame on me for that. But so I think he has some good ideas about maybe how to communicate some of this mission differently. So I'm excited about that too.
Well, good.
You
Good.
have an amazing anniversary. And if you do decide to go to Wyoming, send me a text and let me know.
I will.
Yeah,
I'll be lucky if I make it past Denver.
I know, you won't. You'll be like, oh, I went to the outlet mall. And hang in there. And
I will.
It's just a blessing to know that you're there, and that I have friends that are these amazing leaders, strong women who are making a difference in the middle of a pandemic. I mean, if you needed anything to put on your resume, I think it's I survived the pandemic. I led through the pandemic, whatever. I think that we're going to find this makes us better in the end. But
Yeah. Yeah. Well, and I mean, speaking of something that I got to say, out of this whole thing, who would have ever imagined 3 years ago that Kendra and I'd be working together now? And it's really cool, Monica. It really is. I mean, I would have never thought it. Never ever. And it's great. I mean, we get along. We kind of do our debriefing of an evening. There's Darcy and Kendra and I, and usually around 5:15 we meet and we just kind of vent for 45 minutes, and then on our ways we go. And then we don't talk maybe all day long, and then 5:15 that night we all come in together.
And you know what? I am not, and I don't know Darcy, but I'm not surprised, because you and Kendra are very different, but your passion, your commitment to the community, your willingness to want to make the world a better place, that's what's bonding you. That's what's bringing you together. And it's just neat. Thank you for sharing that. That's
Yeah, because it was really bizarre. I got to thinking that the other day. I said, who in the hell would ever thought we'd been working together?
work. Yeah.